Good morning. Thanks a lot for the invitation to contribute to the debate of today. One slide quickly on our organization. We are a very good mirror of the diversity of healthcare systems in Europe. We represent national organization of hospitals or owners of hospitals. We cover more or less 80% of beds in acute care, so you can imagine any sort of care is delivered. We are, let's say, moving from a hospital-centered organization only and to a more healthcare-oriented organization, also as a general shift in the healthcare systems. What we're doing comparison in this idea of improvement of organization and financing of hospitals. We're doing exchange of knowledge and good practice, and we are trying to also emphasize a lot on hospitals and healthcare services as providers of health, which sometimes is not obvious. We have a yearly topic also, and actually we were here in this room several years ago. We are trying to focus on one item every year, and you see the last 3 years we have been trying to look at challenges that are also challenges for our sector, for the cancer sector. But more interestingly, the last 2 years we have been doing a lot of work around the interface or the difficulties of interface between the different levels of care. So what about cancer? So I wanted to start first of all by putting on the table the diversity of our care in Europe in the cancer field. We have to be very careful with European averages. And when I'm saying European, I'm talking about European Union here. If you look at the cancer incidence, for example, around the EU average, you have quite big differences between what we call the EU 15 and the EU 12. EU 12 are the 12 younger member states of the European Union. Those would join in 2004 and 2007. So you see already quite a difference in the incidence. That may be explained by availability of figures and so on, but that doesn't explain all. So already first issue. If you look at one example, breast cancer incidence, also big variation around the European arena. It is the same also concerning the increase. If you compare the number of new cases between 2000 and 2007, so quite recent information, the latest available, you see huge increases in some countries, rather smaller ones in others. So again, this means there are differences in needs, in resources and in costs in the systems. There are also differences in organization and financing. And the most obvious factors are also available here in those figures. Sorry to give you too much figures, but I want to emphasize on some of them. One of them is the admission rates. So clearly we are not doing the same healthcare when cancer is concerned in Europe. If you look at the admission rates between 2 or 3 countries I selected, there is a difference between 1 and 2. That's an important element. If you look more into details, what is inpatient? So that means patients stay more than 1 night, or day cases. Here, it's even more important. If you look at the inpatient admission in some countries, it's a relation to 1 and 2. Again, the European average is interesting, but it doesn't mean anything if you are interested in one single countries. The day cases are even more striking. When the average is around 10, it's above 20 in the UK, it's around 10 and 20 in some other countries, and it's less than 1 in some others in Europe. So in a nutshell, day cases represent 70% of all admission in the UK, when 3% only in Hungary, Czech Republic or Germany. So it's not, again, an East-West issue. It's clearly there are different ways of handling the same disease. Same goes for the average length of stay. The ALOS, this means average length of stay in hospitals. So around the EU average of 8, there are quite a significant variation. The same goes for female breast cancer. I won't come into detail. You find the same striking elements on the fact that we are not clearly delivering the same sort of care in Europe, just with those figures coming from WHO resources today. If you want to see visualize this same information for female breast cancer, you clearly see that the inpatient in light blue and day cases in dark blue also show the huge differences in the way we are handling care for cancer patients. So what are apart from these facts, this reality, what are the incoming challenges that, again, some countries are facing quite differently from others? So one first element that was mentioned in the previous intervention, it's an important factor we should keep in mind. There are more and more people that recover their health after a cancer episode, which was not the case some years ago. So that's an important factor in the healthcare we provide. And the second important factor is that cancer becomes considered as a chronic disease. If you look at the literature now, it's a chronic disease, it's considered as a chronic disease. That means that patients have some sort of new needs in that case. More attentive, more long-term follow-up, especially after a long period of cure, treatment, and hospitalization. And we are seeing, again, not everywhere, but we are seeing new response with global care issue. And that's also the important element in our work package, to look at the other items than a clearly central care issue. It's not only about care and cure, it's about global support, including, for example, the major nutrition element, which is always forgotten, or in most cases forgotten. Psychological support, also a key element in our work package, and it's now appearing as specific hospital departments or hospital units that are dealing with this sort of issues. Social support, that goes as far as supporting to get loans, for example, for patients. I have some examples. And of course, the personal support of any kind, like the cosmetic also, which is starting to be an important element in the treatment of patients. So a global patient and a global attitude for healthcare providers, including hospitals. The second important element of change is the organization and management approach, which is we are going through more multidisciplinary teams. It's not anymore a single person that is specialized on the cure of the disease, but it's clearly a need of a team of professionals focused on the global aspects of the patient. So more and more, this is becoming compulsory, multidisciplinary teams. And this means also going out of the hospital, which is not easy in the country of hospitals. It's not easy to go outside of the walls. But more and more, it's needed. And also to identify specific mechanism. Here we think about, of course, information technologies, but there are other ways, if you not reach that level, to exchange, to meet with the other colleagues. So the advantages are clear, and they have been mentioned clearly in several presentations already. Patient-oriented, they integrate personalized programs, and they are handling this major component, which is not only for cancer but for all issues, which is the continuity of care. How do you handle the care of the patient throughout their lifetime? So the other big challenges we are seeing is a better link with the other aspects outside the care, which is, of course, prevention, screening, and early diagnosis. Those are key elements. They still seem for us very separated, still in silos in some places. It needs real cooperation, coordination among all actors of different levels, including the cure level. Another two important major elements also changing, and again, you see that in the figures, it's changing with a very different pace in Europe. It's the importance of ambulatory care and hospital at home. They are clearly very different in different countries. It is improving, but it means clear change of mind, change of culture in the hospital-centered culture. Hospital as home also in many countries we see it developed by organizations other than healthcare institutions, good or bad, that's not the issue. The issue is how to integrate them with the other actors in the healthcare field. And more generally, we see this sector, hospitalization at home, not enough funded and enhanced as it should be. So finally, finalizing the presentation actually to the starting point of the previous presentation, and I will be ahead of time. I should have put question marks around those titles. So what we are seeing more and more is more strict mechanism of authorization to treat cancer patients. For example, the presence of multidisciplinary team system within the hospital as a compulsory element in the authorization to provide this sort of care. So that's an important element. Again, not everywhere, but it's a trend that may take time in some countries, but should we look at this, should we be talking about that, I think it's for us an important element. And they are, again, coming back to the guidelines, very detailed guidelines for authorization in some countries, like, for example, the minimum sailing of activity or availability of instruments for radiotherapy and so on. So that's also a very important element in which we should be thinking of. And finally, coming back again to the previous presentation, European Cancer Guidelines. When I talk about European, I mean European Union Cancer Guideline, which means translated in 23 European languages in 3 alphabets and with the stamp of the European Union on it. That's what I'm talking about, because we have guidelines, of course, but they are mostly around screening. We all know about that. So they are not yet there for care. So should it be one of the goals of the discussion, at least of our arena of a joint action, that's also what I wanted to open as a question mark. Thank you very much.
Pascal, thank you very much. Do come and join